Hi, I'm Fara Sax, and this is the Community Voice. I am so excited because joining me today is Dr. Abbe Rosenbaum. She is a cardiologist with My Cardiologist. She's been there for many, many years, but she is extremely excited, and I'm extremely excited to have you here today because we are going to be talking about the Women's Heart Center, which is under the umbrella of My Cardiologist. And we're going to hear everything about women, their risk factors, our risk factors, and how they can be prevented to live a full, happy, healthy life. Thank you so much for joining me today, Dr. Rosenbaum.
It's my pleasure. I'm delighted to be here. This is a subject that is, if you'll forgive the pun, near and dear to my heart.
Oh, wonderful. So tell me why how this all came about. You're a cardiologist and you see multiple kinds of patients, women and men, but now you're focusing on women's health.
Correct. So when I first went into practice many years ago, there was very little awareness of heart disease as a risk to women. We take care of lots of men, but women didn't come in to be seen. So I did some community outreach and I gave some talks in the community, and women didn't come. And I initially thought it was something that was wrong with me. And then I realized that the real issue was that women did not perceive heart disease as a risk to them. And this has clearly improved over the last 20 years, but we still have a way to go. Some women are aware that heart disease is a risk, and some are not. And particularly among Latino women, there is little conscience of this.
So why did My Cardiologist decide to jump on and become the Women's Heart Center, open that up to the community?
So we'd like to raise awareness of the risk, and we'd like to reach women who are at risk, who are not being taken care of. And we want to make it in a safe, welcoming environment for them. Many women are hesitant to come in. They don't consider themselves a priority, and we'd like to facilitate that for them.
And so is it within the My Cardiologist practice, there's a separate door or a separate room or just a different approach than we would do with the general public?
So it is a slightly different approach. It's a program that's staffed only by women from entrance to exit. It is within the structure itself of My Cardiologist, but these women will receive tailored attention.
So you are one of how many physicians, cardiologists that are going to be involved in this program?
So we're blessed to have 4 female cardiologists, which is unusual in our community, and all of us will be participating in taking care of women.
This is a wonderful thing. So tell me what people can expect, what kind of services will be provided and for women to access at the center.
Okay, so we have a dedicated number and a dedicated email so that we can facilitate scheduling, and we have several locations. We have 5 different locations.
So this is all in Miami-Dade County. South Miami location. Tell me where else.
So we have 2 locations in South Miami. We have one in Coral Gables, one in Kendall proper, and one in West Kendall, as well as one in Doral.
Ah, interesting. So what kind of services are being performed at the centers? I just want to do a quick reach out to contact information if a woman wants to get to hear more. It's mycardiologist.com, or the designated number is 786-434-6496.
Perfect.
Good. You did that well.
Yes, and on the website there's an email. There's a link to an email which will come to us directly, and we have staff in the office dedicated to this.
So what will happen at the center as different as it is to the rest of the practice?
Okay, so when a woman identifies herself as interested in being assessed for her risk, she'll receive an appointment, and when she comes to that appointment, we will collect the information that we need in terms of deciding or determining what her risk is. There are certain risk factors that everyone has for heart disease, and those are the traditional ones that most people are aware of. High blood pressure, high cholesterol, diabetes, inactivity, excess weight, smoking. And then we've identified over the last couple of years, there's been a lot of research, and there are gender-specific risk factors, meaning risk factors that are specific to women. So women who've had pregnancy-induced hypertension or preeclampsia or eclampsia are at greater risk of developing heart disease, and they do so earlier than women who haven't had them. Women who've received treatment for breast cancer, albeit chemotherapy or radiation to the left chest, are at greater risk.
So you mean what you're saying is that if one was pregnant and had these preconditions, later on in life, they will develop this 10 years earlier than someone in the general population?
Correct.
Wow, that is like so amazing. Is there something one can do to preempt that so they don't go into prediabetes or the preeclampsia or eclampsia? Is there something that could fight that off? I mean, I know
So
that's more of an OBGYN question,
Right.
but what can one do to
So
lessen
if you
those
know you're at
risks?
risk, if you know that you're at risk, 70% of heart disease is preventable. So there are many lifestyle and treatment issues that can be attended to before you develop heart disease. And those are women we're trying to reach.
So in cardio, some statistics that just blew me away. Cardiovascular disease is the #1 cause of death.
It's the #1 cause of death and illness in all women, greater than all cancers summed together. So greater than the combination of breast cancer, colon cancer, lung cancer, skin cancer, uterine cancer, cervical cancer, all of them combined, heart disease kills more women.
And what are some of the symptoms one, you hear about the men, like it's really just right in their face, you've had a heart attack. But what
So
for
the
women?
women-
What is the subtle, maybe underlying or silent?
So you're right. The variety of symptoms in women is much broader, right? So women can have discomfort, pressure, heaviness in their chest, their neck, their jaw, their left arm, both arms between their shoulder blades, but it can be something much less noticeable than that. An unusual fatigue, an episode of indigestion different than the usual, a sense of tiredness, an episode of shortness of breath, an episode of sweating. I had a woman who came into the office once. She said, I've had these episodes of sweating. I don't know exactly what's going on. And she was in the midst of having a heart attack.
Very amazing. So you were able to help her before it became like coming for you wheezy, right? You know, but
Yes.
but to make light of a very heavy subject. But sometimes it can be anxiety. And like differentiate, someone can go to a hospital and they're having an anxiety attack, correct? And like,
So there are two parts to that. So anxiety is a bigger risk factor in women than it is in men. Stress and anxiety and depression are greater risk factors in women than they are in men. And then sometimes it's difficult to distinguish the symptoms because they can occur in the same place. So always better to be safe than sorry. Better to have gone to the emergency room with indigestion or with anxiety than to have stayed home with a heart attack.
absolutely. We're getting back to some of the other risks. 90% of women have one cardiac risk factor.
Correct.
Oy
It's
vey.
huge. That's huge.
Like,
Right.
what are those risks?
Okay, so we'll go back to some of them, and I'm sorry if I'm repeating myself. So the traditional risk factors are smoking, high blood pressure, high cholesterol, diabetes, inactivity, overweight. Yes?
Yes.
Um,
I
and
guess,
that-
yes.
yes,
Yes. I'm now
well,
a doctor with
A
Dr.
family
Rosenbaum.
history of premature heart disease, meaning heart disease that occurred before the age of 55 in a male or before the age of 65 in a woman. Premature menopause is a risk factor. So if you had menopause before the age of 45, there's a greater risk of developing heart disease. And then there, as I was mentioning before, gender specific. Complications of pregnancy such as eclampsia, hypertension, or diabetes, treatment for breast cancer with chemotherapy or left-sided radiation, or a history of autoimmune illness, which is also more common in women, such as lupus, rheumatoid arthritis, psoriatic arthritis. Those chronic inflammatory states raise the risk of heart disease, so it raises it more often in women.
Interesting. And I don't know if you want to speak to this, but COVID, when we get into COVID, are we okay to talk about COVID and heart, or we're not there yet?
So there are many manifestations of heart disease with COVID. It's a different entity than when we traditionally talk about, when we talk about heart disease, we're talking about blockages in arteries. So yes, COVID can present with arrhythmias, with heart failure, with an inflammation of the heart muscle, with heart attacks. So that's all true, and that happens in men and women. But the mechanism there is slightly different than developing blockages in arteries.
Absolutely. So if one is feeling any of these symptoms that you just named, is to quickly get involved, get to either my cardiologist, to you, or to the hospital to
Yes,
see
if you-
what's
if you-
really going on.
If you've had COVID, or you're recovering from COVID, or in some cases, very, very unusual cases related to vaccination, if you develop shortness of breath, heaviness in your chest, difficulty breathing, then yes, you should be evaluated.
And then some of the other stats are 70% of cardiovascular disease is preventable. Oy vey, really? Like what?
Well, that's why we're doing this, right? So if you have excess weight and you lose it, if you have blood pressure and it's treated properly and it's well controlled, if your diabetes is well controlled with a hemoglobin A1C under 7, you have to know your numbers. if you can modify those risk factors, then you diminish your risk.
So now with the women's center that you're opening for women, for their heart, are you working with their doctors, their primaries to help them along so that it's really a synergistic,
team
holistic,
approach.
Right, go team, go. Let's get everybody healthy and well. I must tell you that Dr. Rosenbaum is my doctor and at My Cardiologist. And I just want to tell you, she's taken really good care of myself and my family. And it's very, her approach is very preventative. Let's take charge now before we really get into a slippery slope with the heart. And I really appreciate that. You're just right on target and money and just take care of myself very, very well. So I'm here to tell the story so far. So it's all good. So I'll give a plug for My Cardiologist and for you.
Love to hear it.
Yes.
So yes, our approach will be to try and identify each individual's risk and how we can best modify them to try and prevent heart disease from occurring. And if in the process we encounter issues that require attention, then we will provide our attention, whether it's treatment with medication or procedures of any kind. Our office is a large office. We have all the subspecialties of cardiology within our grasp. So many of my colleagues, they specialize either in heart failure or in pulmonary hypertension, or they specialize in management of blood pressure or electrical issues, so arrhythmias and fainting. Or if you have blockages and they need to be fixed, we have interventional cardiologists that deploy stents and balloons and unblock arteries. So we have all the subspecialties.
And very many locations to choose from. So there are a bunch of cardiologists at
lovely. My colleagues are lovely.
They are. I know a lot of them. They're wonderful. So it's wonderful. So cardiovascular disease, the number one cause of pregnancy-related deaths. I know that's a little bit out, but that really just
right.
That's
so
pretty
pregnancy-induced hypertension, eclampsia, and preeclampsia and pregnancy-induced diabetes are complications that contribute hugely to maternal and fetal death. Right?
So women that are having these issues should really stay on top of their medication, stay involved with their OBGYN to really keep this at bay so that one can have a healthy mother and child at the end of the day. Awareness of the risk of cardiovascular disease has improved but remains lowest among Latino women. What's that about?
Unfortunately true. So men, I believe, are very aware that they're at risk for developing heart attacks, and you have all the social and media stereotypes of men having heart attacks and clutching their chest. But women are not quite aware that they're at risk, and so they don't seek care. The other problem is that women take care of a lot of other people. And they're usually low down on that list of taking care of husbands and family members and parents and their children, and they come very low at the bottom of the list, and so they don't seek care. Or there are other women that aren't comfortable seeking care, or they're embarrassed that they have an extra couple of pounds on board, or that they haven't been eating as healthy as they could, or they're not exercising as they think they should. It doesn't matter. We're happy to see everybody and hopefully get everybody on a path to health.
Absolutely. And you brought a little model with you, and maybe you could just show me a little bit what's happening. It looks like someone's heart.
Okay, so this is a heart, and a heart has 4 chambers. It has 2 bottom chambers, and it has 2 top chambers. And the heart, the left ventricle is the main pumping chamber, and it squeezes and it pushes the blood out through our aortic valve, and the aorta is the main blood vessel. It comes up and around, and it goes from the very top of our bodies to the very bottom of our bodies. It's like I-95, north to south. And it gives all the blood vessels, gives branches to the brain, branches to the lungs, to the gut, to the liver, to the spleen, and then divides.
And the problem is that when the traffic starts backing up on 95, like our heart, right?
Right. So that's an interesting metaphor. So when we talk about heart disease, and what we've been talking about is mostly development of blockages in the arteries. So if you can see this artery, when we're young, if you think of an artery as a garden hose, right? If it's a garden hose and we slice it lengthwise, and I hold it up like this, when we're young, there's nothing inside the artery and the blood flows freely. With time, we all develop plaque in the walls of the arteries. Everybody does. It's part of our process of aging. Some people do it to a greater extent and some to a lesser extent. But if that becomes excessive, then it interferes with the flow of blood.
So then what can you do? How do we interrupt this blockage and some of the procedures or treatments one can do to live a healthy life without having continual heart
So we try
disease?
and minimize the development. We try and slow it down. So yes, I said that everybody has some, but we try and slow down that process. And the factors that contribute to the development of plaque are the ones that we talked about, whether it's your family history, or it's your lack of activity, or it's a blood pressure that's not well controlled, or cholesterol, be it good cholesterol, bad cholesterol, triglycerides that are not where they need to be, then if we address those, we can try and slow down the process. Now, if you've developed blockages, the hope would be to identify those blockages, identify those symptoms early so that we can intervene and treat whatever blockage has developed, whether it's with a stent or whether it's with medication. Heart attacks occur, those are the unexpected events, and we can't identify or predict all of those. But what happens is that the plaque breaks up and the body identifies that as an injury and forms a clot on top of a partial blockage. So if you think of an artery that maybe has a 30% blockage or 40% blockage, all of a sudden there's a clot on top of that. So the artery is completely closed, the blood flow is impaired to the rest of the muscle in that area, and that's when a heart attack occurs. That heart muscle is damaged.
So it was really your body's defense mechanism works against you, sort of speaking.
Sort of, yeah.
Wow. And what about diet? Let's talk about, is like one diet better than another? Keto, Mediterranean, low carb, high carb, There's so many
There's a whole
things.
variety, and
Yeah,
we're
it's
very
really
prone to fads, aren't we?
Yeah, but like what do we listen to? Where do we get that information where we can just start in a very, what we put in for starters?
So we're happy to provide it. But
Is that part of the Women's Center?
Absolutely.
Okay,
Yes.
so tell me about that.
It's trying to select a diet that's appropriate for you. From a cardiac perspective, we're looking for a diet that's low in saturated fat. Saturated fats are mostly animal-derived fats, meaning meats, dairy products, eggs, and then there are a couple of non-animal sources such as coconut oil or palm oil. But of the diets that have been shown traditionally with research, that have been tried in large groups of people, the DASH diet, which is a diet that was originally developed to prevent hypertension, high blood pressure, that's readily available, and it's very healthy from a heart perspective.
So what does the DASH stand for?
It is the prevention of systolic hypertension.
Okay. And where can we can access
It's
that?
online.
Okay.
It's online. DASH. And I'm sorry, my memory is failing me.
That's okay. No, that's good. But I think that information is really important as a baseline to start with our diet. So
Right.
it's really it's basically a grazing kind of diet where you're just not eating
So it's a
saturated.
diet that's very balanced. It's a very well balanced diet. It's a diet because it was originally designed to prevent high blood pressure. It's low in sodium, higher in potassium, because that's a kind of diet that's helpful for high blood pressure. The Mediterranean diet has lots and lots of data to show that, to demonstrate that it leads to heart health as well. So that's another choice.
Phew, okay.
But the truth is, from a medical perspective, if you have a lot of extra weight, any way you lose it is a good way. Any diet that you can stick to is a good diet.
Right. And do you really look at the BMI? Is that like something
Yes,
that's
it's very, very useful.
So if we're like
So body mass index is based on what your weight is and your height. And it's a calculation. And then based on your body mass index, you know whether you're in normal range or whether you're overweight or whether you're obese.
And so the Women's Heart Center, what are these materials available? Are you going to be educating? Tell me a little. It's a new pilot program.
It's a new pilot
really.
program,
Look at that smile. I love
We're very
it.
excited. We're very, very excited about it. So yes, so a woman comes in, we assess her history, her medical history, what her specific risk factors are. We do an exam, an electrocardiogram, and then decide if any additional testing is necessary, whether the person has recent labs or we need to order labs. We need specific labs for cholesterol or if there's a family history. And then based on that, we determine what the risk is. And then we will help develop a plan, whether it's to help aid with weight loss or aid with lowering cholesterol or better blood pressure management or better diabetes management. We can incorporate all of those, and hopefully the woman will walk out with a better idea of what she needs to do to be healthy. And then we'll have her come back and see if we've been able to make improvements.
And it's so nice that it's women with women. I think that's just it's a real bonding kumbaya moment. It really is because we get to be heard as women by physicians who understand women's needs.
Right.
What else can you tell me about the center? I'm really excited. I can't wait to be that part of it. But I have you.
Exactly. So the program isn't for people who are already under the care of a trusted cardiologist Or they're trusted, if they have a trusted primary care physician that's attending to all those risk factors, they don't need to come. We're trying to reach women who, for a variety of reasons, haven't received preventive care, right? Haven't received the cardiac care that they need.
So, and they would get in touch with you through mycardiologist.com or 786-434-6496, which is a designated number, and email. There is a drop down to, they can email directly and reach one of the wonderful female cardiologists on staff. In the time we have left, tell me something else that we might not have covered that you would like to talk about.
I'll tell you about my colleagues.
I would love to talk about. Funny you should ask. I was going to just tell me about the colleagues that are part of this.
So there are four of us. So my three colleagues. There's Dr. Lauren Frost, Dr. Vicky Soto, and Dr. Kristen Burton.
And they've been with the My Cardiologist group for
years at this point.
And you've been with them for many, many years too. Well, it's
over 25 years. But
how does that happen? You look only 35 years old. How did that happen? I'm your sister of that 35-year-old.
You're very kind. Well, you know what? It was my first job when I first finished my training, and it's a wonderful group, and we've grown and grown and grown, and I've been very happy here. So I've had no reason to go elsewhere.
It's so funny. I've been with community newspapers for almost 25 years. So if you're happy, why go somewhere else? And if you're really reaching people and able to service and make them well, like you're doing, I mean, you're doing the job, and you seem so satisfied.
And I love Miami. So I don't want to go anywhere either. We've raised our family here, so we're very happy here.
So tell me about the other doctors as well.
So they're excellently trained, empathetic, lovely women I've had the privilege to work with, and they're ready to see patients.
And how old do you think women need to be to become part of your center, the Women's Heart Center?
There is no number written in stone, but for preventive purposes, usually 40 and above.
So that's the first time.
Unless they've had complications of pregnancy.
And what about women that have family history of heart disease? Should they come earlier?
It depends on what that family history is and what their profile is. Probably somewhere around 40, certainly before menopause.
Absolutely. And you're there and we can get an appointment next couple of days after we make the initial contact?
It should be relatively easy. We've designated a couple of days, specific days of the week, where we'll make ourselves available just for this. So it will be easy to make appointments.
And it's throughout all of different areas throughout the Miami area. So it's really conveniently located to wherever you may live or work and being able to be seen by a doctor.
Well located, easy parking, easy access.
And we're
bilingual.
Where'd you grow up, speaking of bilingual?
Well, I'm a little bit of a gypsy. So I was born in New York City.
Oh, really? Where?
I was born in Queens.
Oh, me too.
Really?
Oh, yeah.
We didn't discuss this before.
No, I'm glad we're having this moment.
So I was born in Elmhurst, lived
Rego
in
Park?
Flushing, and then I lived in Forest Hills, which is right across from Rego Park.
Oh, absolutely. And then when did you move? When did you leave there?
So we moved to Columbia when I was 14.
Oh, so you went from...
My parents were originally from Columbia. My father was a physician. He finished his training and went into practice in New York City. At the time, there was a real need for Spanish-speaking physicians. And then after many years, he went home, so to speak. So we lived in Columbia. I lived in Columbia for about 10 years. And I've been back in the States ever since. I've lived in Boston, and I've lived in Connecticut. I've lived in Cincinnati. I actually moved to Miami from Cincinnati.
Oh, wow. Cincinnati is a beautiful, beautiful place.
It is.
Cold as heck, though.
Not so cold.
No, okay, all right.
Boston was much worse.
Yeah, well, that's really cold.
Definitely much worse.
So what inspired you to become a doctor? Like, is it because of your family, or is it... Where did that happen?
I come from a family of physicians. I can't even tell you that I'm the first female physician.
Wow.
I wanted to be a physician from childhood.
And a cardiologist to boot?
That changed, actually. That was a love I found along the way. But in junior high school in New York, there was a 3-year, there's like a compressed junior high school, and I did it because I needed to get to med school. My mother kept asking me, why are you in such a hurry? And I'd say, well, I don't want to be so old when I finish. So I always wanted to go to med school. I come from a family of physicians. My brother's a physician. My father was a physician. My mother wanted to be in my grandparents didn't let her. I have cousins and uncles. We have all the specialties in our family.
Wow. You're delightful, and I appreciate you taking the time with me today and to talk about the Women's Heart Center happening right here in our beautiful community, to outreach for any issues that one may have, any questions you have, whether you're male or female. The doors are open with wonderful physicians at My Cardiologist. Dr. Abbe Rosenbaum. Thank you so much for joining me today.
Thank you, Fara, for inviting me.
And I want to thank you, and please visit again. And I'm glad you sat with us and talked and listened about heart health, and maybe you learned a thing or two, and the outreach is there. And just feel free to give My Cardiologist at 786-434-6496 a call, and they're there for all your health needs.
I look forward to seeing you.
Thank you. Have a great day.